Well, welcome everyone to episode 2 of How Do We Function? And today we get the lucky guest of Dr. David Brady. How are you?
I'm doing good. Thanks for having me on your show.
Yeah, no, thank you so much. And before we get started, I just wanted you to introduce yourself for a little bit. Tell us about, how you got into your work and stuff like that.
Sure. I'm Dr. David Brady, as you said. I'm a licensed naturopathic medical physician in Connecticut and in Vermont. I'm the Vice President of Health Sciences here at the University of Bridgeport, where I'm coming to you from my office, and the Chief Medical Officer of Designs for Health, a professional nutraceutical nutritional supplement manufacturer, and diagnostic solutions lab. Kind of involved in industry and in academia, and also in clinical practice of integrative and functional medicine. I've been in practice for about 25 years. I practice at Whole Body Medicine in Fairfield, Connecticut, and I really specialize in autoimmune disorders and global pain and fatigue disorders such as fibromyalgia, among other things. So happy to share what I know about those things with you. And I'm the author of the book, The Fibro Fix. That's my latest book. So people can check that out if they would like. And I'm free to ask any questions you want.
My goodness, that's a mouthful.
Well, there you go.
Well, I guess the first biggest question is, as you say, you're in functional medicine, and what is the main goal of functional medicine?
Oh, that's a good question. That's sort of a hour response, probably. If I let it be, I'll try to make it brief. Functional medicine is probably the most evidence-based modern movement within the medical community. That's an evidence-based approach that looks at chronic disease and health and wellness from a different perspective than the orthodox conventional allopathic approach. So rather than looking at people as either having a disease or if they're absent from a disease that they're healthy, we don't look at it that way. We look at their levels of function, hence the term functional medicine, in the continuum between one extreme having a disease, an overt pathological disease, and on the other extreme having optimal wellness. That it's not a binary thing. There's a lot of space between not being optimally well and having an overt disease. And the current medical system is based around an acute care reaction model where they kind of sit around and wait for you to have a disease, and then they have a treatment, and the treatment's usually pharmaceuticals or surgery or the kind of treatments we're aware of. Where in functional medicine, we try to look way more upstream, be very much more proactive, to try to assess people and their level of function in various organ systems and critical areas of biochemistry and metabolism, to try to promote them being as robust and well as possible. And should they already, unfortunately, be in a state of disease, particularly with a chronic complex disorder, we use a lot of different mechanisms to try to nudge them toward being well again. And it could include the use of drugs and the use of different procedures or surgeries, but we actually try to avoid that. We try to use a lot of lifestyle interventions, stress mitigation, botanical medicines, clinical nutrition, dietary changes, and a whole bunch of other stuff.
Well, that's awesome. I mean, it's mostly about trying to prevent you from having a problem.
Ideally, but unfortunately, a lot of people come see functional medicine doctors after they already have a problem that motivated them to go. So we're trying to change that because it's a lot easier to deal with someone when they're still relatively healthy and keep them that way than it is to get them healthy once they're not.
Exactly. Well, as you said, you work with a lot of autoimmune disorders.
I do.
What got you interested in that, particularly the fibromyalgia?
What got me interested in both of those conditions is sheer desperation. Having a lot of patients with those things, having received inadequate training in my conventional training. I was trained initially. I was trained initially as an engineer in electrical engineering, worked for McDonnell Douglas Aerospace, so I had a very analytical mind, but I then found more medicine and healthcare practices and trained first in chiropractic and more physical medicine, then trained in clinical nutrition and then in medicine. So I kind of look at it from a lot of different perspectives, but regardless of any of those trainings, I really didn't get trained the way that I approach now autoimmune diseases, nor fibromyalgia and global pain disorders. So I
Oh,
had to go make myself an expert on my own by reaching out to some of the best researchers and the best clinicians in the world, by reading every single journal article I can find on it, every textbook. And then over the course of 20 years, 25 years in academia, research, and practice, becoming one of the opinion leaders on both of those classes of disorders, and a researcher and a clinician with a lot of experience in them. So I intentionally, made myself a much more educated person on those subjects because I wasn't taught that in school.
no, and that's amazing, especially like you took the initiative. You know, you weren't happy with what you were being taught, and so you went and taught yourself.
Well, it wasn't good enough, and I'd like to say that that's changed, but it hasn't. The doctors getting out of school this year have not been trained adequately in either of those conditions, unfortunately.
Yeah. Well, with that, what would you say is your process of assessment when it comes to someone coming in with an autoimmune disorder?
Well, in an autoimmune disorder, the way we look at it in functional medicine, and this is regardless of the autoimmune disease label, right? Because whether you have lupus, or whether you have rheumatoid arthritis, or Hashimoto's disease of the thyroid, or MS, or name the autoimmune disorder, it's just the product of the same phenomena, which is the immune system fundamentally no longer being able to discriminate between what's you and what's an outside threat. And depending on what tissue that the immune system decides to pick on
Mm-hmm.
and start destroying of your own, that's where it gets its name. However, we back up and look at it more upstream. What is causing the immune system to fundamentally go off the rails and to not be able to behave as it was intended? And generally, we know that what causes this in genetically susceptible people is that they have an exposure to some sort of exogenous or environmental antigen. And by antigen, it's usually a protein of some sort. That protein could be a protein that's a component of a food we eat. It can be a protein that's expressed on a bacteria that's overgrowing in our gut, let's say. It can be some of the protein peptide sort of characteristics of a virus that we may have been exposed to, but it's some kind of outside entity, virus, bacteria, toxin, food, that for some reason, as a unique individual, that person overreacts to it. It has a unique immune characteristic which sort of freaks out when it sees that foreign entity, and reacts to it as if it's an imminent threat to their survival. And if that protein, or that external shape of that peptide looks enough like a protein or peptide that's on a host tissue, then the body can lose discrimination, particularly if it's inflamed and sort of not in great balance to begin with. And it's trying to attack this invading protein, but it sort of gets confused, if you will, and it
Mm-hmm.
attacks something that looks almost like it, that's actually part of your own body structure. So let me give you one example. For people who have Hashimoto's autoimmune disease of the thyroid, we know that they have a high prevalence of overgrowth of a bacteria in their gut called Yersinia enterocolitica. Yersinia, when it overgrows, it's an opportunistic bacteria that can overgrow in some people, has proteins on its surface that look a lot like TSH receptors on your thyroid. So the body's immune system makes antibodies to bind to the antigens, which are the proteins on Yersinia, and when those antibodies are going through the blood, they see the TSH receptors and they say, that's pretty close to what I'm trying to
Mm-hmm.
latch into and destroy. So they latch into the thyroid and they destroy your thyroid over time. A similar scenario with the overgrowth of Klebsiella and Citrobacter in the gut. They have proteins that look like proteins on your synovial joint lining, so they can cause destruction of the joints, which would be called rheumatoid arthritis or ankylosing spondylitis. But it's not only bacteria in the gut. We know that gluten, for instance, gluten and gliadin in fieldgrass grains, if you have a genetic susceptibility to overreact and present them in a certain way to your naive T cells of the immune system, you can actually attack your own thyroid and your own brain cells. So, gluten and gliadin intolerance is associated with higher incidence of Hashimoto's and Graves of the thyroid, and then later than that, longer term,
Mm-hmm.
early onset dementia. But there's viruses like Epstein-Barr virus, cytomegalovirus, and others that can also trigger autoimmune disease. So in functional medicine, we climb upstream, we go after hunting what are these different triggers that, at least the ones we know of right now, that may be associated with your specific type of autoimmune disorder, and we try to remove those and take those off the landscape. We try to repair the GI microenvironment. We try to make the gut lining less porous, so we treat leaky gut syndrome because that's part of the genesis of autoimmunity. We hunt down these viruses and try to get your immune system stabilized against them. We try to clean up the diet to anything that doesn't get along with your immune system, and use various techniques to try to just make the immune system behave a little bit more like it's supposed to.
Well, you talk a lot about the gut and how it basically touches different parts of the body. Even like you said, like dementia can
Oh yeah,
come from the
yeah.
gut. You have a lot of writing out on the web, and I found something about you talking about intestinal restoration, and you have 4 R's that you have to go along with that. And can you explain that process a little
Sure,
bit?
and that's not my 4R paradigm. That's actually something that developed over many years with functional medicine providers, and I think it was first really widely propagated by the Institute for Functional Medicine, and probably before that, the work of one of my mentors, Dr. Jeffrey Bland. And basically, it's a simplified roadmap for clinicians to think of when they're trying to go about optimizing gastrointestinal function, because it's so important to keep someone healthy. I mean, Mechnikov, the great Russian pathologist back at the turn of the 20th century, coined the term "death begins in the colon," right? Because if the gut goes bad, everything goes bad sooner or later. You can't be healthy with a fundamentally bad immune system. And by the way, he's the father of probiotics, for instance, the
Mm-hmm.
use of cultured dairy products, yogurts, and fermented foods and things like that in a modern Western medical construct to treat disorders. But the 4 R's really, and some people include 5 R's. There's various sort of iterations of this, but the first R is basically remove. And what do you remove? You remove offending foods. So we do a lot of testing with foods against your immune response, and foods that activate the innate immune response or inflammation. We take away for a while, so we do an elimination and then eventually a reintroduction diet. So we remove offending foods, but we also test for and remove problematic microbes in the gut. So, like Yersinia and Klebsiella and Citrobacter and Proteus and some of these other ones that we know are associated with higher incidence of autoimmunity. So we're removing the bad guys, whether they're bugs or whether they're foods that don't agree with you. That's the first R, remove. Then we have the second R, which is replace. What do we replace? We basically often will replace any deficiencies of digestive enzymes, so pancreatic enzymes, so like lipase, amylase, proteases, things to help you digest your food better so they're less antigenic and less likely to cause an immune response. The third R is repopulate or reinoculate, and what that really means is giving the good bacteria to the gut, lactobacillus, bifidobacteria, for either through supplemental probiotics and prebiotics, or through fermented products that have those things in them. And then the fourth R is repair, and repair means repair the gut lining. So there's a lot of things that we know that feed the cells of the mucosa of the gut lining. Things like L-glutamine, for instance, is the preferred fuel source for the gut cells. But we also will use things that heal up the gut lining when it's inflamed and irritated. Some of these things are from more traditional botanical medicine, influence, all of the slimy herbs. So things like okra. Do you ever cook okra and it has that slime in the
Yep.
middle? It's mucin that can coat the gut and help heal it. Deglycerized licorice, cat's claw. There's many aloe, for instance. Aloe is very slimy. You put it on a sunburn. Well, these are mucilaginous botanicals that can really heal the gut lining. We use N-acetylglucosamine, which is a mucopolysaccharide that blocks immune antigen antibody reactions in the gut, so slows down that runaway immune response in the gut. So there's a lot of sort of modern nutraceuticals that we will use for various biological responses. Some of them are rooted in old traditional medicine where they knew this stuff worked, they just didn't quite understand how and why it worked,
Hmm.
but they empirically observed that it worked. And now we can pick it apart with modern science and figure out, well, what's the mechanism? Why is it working? How is it working? We can actually improve upon it by, producing modern nutraceutical medicines and botanical medicines that are much stronger because they're, let's say, standardized or fortified in one or several of the active ingredients versus the raw herb or the raw food.
Awesome. Wow. Thank you. That was very in depth. I appreciate that.
Sure.
Um, Going back a little bit, since I know fibromyalgia is more your niche, um,
Right. It's one of them. Yes.
what
Absolutely.
what is your assessment specifically for that? Like, I know red skin syndrome is what a lot of um, viewers have right now, and it's
Right.
sort of part of the autoimmune disorder. They're
Right.
in there. But we also have other issues like rheumatoid arthritis, like fibromyalgia. So it's really important, especially since you specifically know so much about fibromyalgia. Is
Well,
there
let me back up first and say fibromyalgia is not an autoimmune condition. It's
okay?
not even an overtly inflammatory condition in its true form, which we call classic fibromyalgia. But there are a lot of people that have pain, that have gut issues, that have depression, that have sleep disturbance, that have fatigue, that get mislabeled or misdiagnosed with fibromyalgia that actually do have inflammatory and autoimmune conditions. So there's a lot of crossover. Unfortunately, the crossovers created by misdiagnosis and confusion often. But when you talk about red skin syndrome, it really is part of this whole thing because when someone's immune system is not right, there's autoimmunity or there's immune dysregulation. And maybe there's leaky gut and there's toxicity and there's foods being consumed that are not getting along with your immune response. One of the most common manifestations of that symptomatically is that you get breakouts in the skin, that you get some sort of skin lesion, whether it's eczema or dermatitis or whatever they want to call it,
Yeah,
right? So the skin is sort of the last ditch effort of the body to be able to remove stuff, to get rid of toxins and to excrete when the normal routes of elimination are not working right or are blocked. So in response to that, the functional medicine doctor would start going, hey, why is the skin like that? Maybe we need to look at elimination, detoxification, the gut ecology, the leaky gut, and we need to clean up the diet. We need to change things. Where
hmm,
the conventional approach is, well, let's just throw some corticosteroids on top of it
exactly.
and blow out the immune response, which takes away the lesion or makes things better temporarily. But it's like putting, a new coat of paint over a rusty metal shed without getting rid of the rust and repairing it. It
Exactly.
looks good for a little while, but sooner or later the rust comes back through because you didn't fundamentally get to what was wrong. And that's what happens when you use these strong immune suppressive agents like corticosteroids on top of the skin. Now, I'm not saying that there's never a proper use of them or a
Right.
reason to use those, but you can't have that be the only sort of weapon in your arsenal to deal with these things. And unfortunately, that's generally the case in conventional approaches. Some people, as do not respond well to those, particularly if you use them for a
Yeah.
prolonged length of time, and then you try to withdraw from them, and you can get sort of an even angrier response. So while I'm not an expert in that disorder, I certainly appreciate that the best way to deal with that is to first of all avoid it ever happening by
Yeah.
properly treating things before you ever get to that point.
Find the
Okay,
cause.
right. So, but with fibromyalgia, a big issue is to properly diagnose it, and that's what I really have made sort of a 20-year mission in trying to educate my colleagues, physicians and other healthcare providers, how to properly go through differentially diagnosing someone who may think they have fibromyalgia and not calling things that are not fibromyalgia.
Mm-hmm.
Because fibromyalgia is not an autoimmune condition, it's not a muscle problem, it's a central brain pain processing disorder. It's a hypervigilance, what we call the central sensitivity disorder. So there's dysfunction deep in the brain and how it processes information, and it perceives pain all over the body. There's a lot of inability of the mind to rest. It's in a hypervigilant, sort of ready for the next catastrophe kind of state, so you can't really adequately go into restorative deep delta wave sleep, which makes you fatigued, which can cause depression, anxiety. There's a lot of gut issues going on because of the way the neurotransmitters are dysfunctional. But if you treat it with corticosteroids, with anti-inflammatories, with pain relievers, with all these other things, it just doesn't work because that's not where the problem is. And by the way, a lot of hands-on therapies like massage and chiropractic and physical therapy and acupuncture, things that treat the body, the muscles, where it hurts, generally in classic true fibromyalgia do not work very well because the problem is not out there where they perceive the pain. The problem is actually in the brain. You got to treat it centrally by working with the stress response in the central nervous system and the neurotransmitters. If the physical medicine hands-on stuff works, which it does in a lot of people, they don't actually have fibromyalgia. They were mislabeled. They usually have myofascial pain syndrome or actual problems in the muscles. They have musculoskeletal orthopedic type of problems
Mm-hmm.
that should have never actually been called fibromyalgia to begin with. So, as they say, in the first day of medical school, proper diagnosis is half the cure. And there's rampant misdiagnosis going on in fibromyalgia, even by physicians. So, if you add into that the delay diagnosis of fibromyalgia, that's an even bigger issue to deal with, because a lot of people may think they have fibromyalgia not because a physician diagnosed them, but because their neighbor told them they had it, or because they went on WebMD or they consulted Dr. Google, right? And they may be right, but often they're wrong.
Got you. Well, thank you. That was an amazing answer. But moving on a little bit towards supplementation, because on your website I've seen that you have your own supplementation, and I just wanted to know what made you create your own line.
Well, part of most of my professional career, at least almost 20 years of it, I've been involved in the nutraceutical, nutritional supplement industry as a expert technical, clinical consultant, as an educator, opinion leader, lecturer. But probably about 16 or 17 years ago, I first started becoming a formulator or designer of nutraceuticals for physicians and for the professional space. And in my role as Chief Medical Officer of Designs for Health, I oversee a large department which does product development in these kind of products for physicians. So I'm very knowledgeable about them, not only in their clinical use, but in their design and their underlying mechanisms and the science behind them. So when I try to then take this story I've been telling about my experience with fibromyalgia by basically publishing in the peer-reviewed medical literature, by publishing textbook chapters and other types of things that were meant for my colleagues to read. I've been being told by many people for many years, hey, you really need to write a book directly to patients, right? So they understand this more. And I just never really quite had the time and the ability to do it. And I'm honestly more of a science writer than I am a laybook writer. So, but I finally got convinced to do it because I thought, you can only go so far with sort of preaching to your fellow colleagues.
Mm-hmm.
You really sometimes need to take the story to the streets, as they say, to the people who are most motivated to really understand this and learn about it and to become their own best self-help advocates to try to navigate this
Exactly.
medical system, which really doesn't treat them very well when they have fibromyalgia or any chronic disease. So it was really bringing this collective experience from research, from academia, from clinical practice to the book, The Fibrofix, and giving people ways that they can empower themselves. And part of that is to have them do everything they can on their own to try to determine, do they really have fibromyalgia, or might they have some other disorder that masquerades as it. And the book tries to work you through those different algorithms to find out through questionnaires and examining your own experience and symptom profile and so forth. But also some self-help things in the way of calming the nervous system with cognitive behavioral therapies and moving again and regaining motion and range of motion and flexibility in a way that doesn't make you feel worse while you're doing it, but also attacking the biochemical side and trying to foster a better balance of neurotransmitters that are responsible for the stress response, for perception of pain, for proper intestinal function, for quality sleep. And there's many ways that we can do that with nutraceuticals, botanical medicines, certain amino acid neurotransmitter precursors. So I designed various nutraceutical supplement products in the Fibrofix line under that product banner. And I also designed sort of an entry-level 21-day sort of metabolic clearing detox. And that's not a treatment per se for fibromyalgia or any other disorder. It's really sort of clearing things out that sets a better stage for recovery to get the toxins out, reduce your toxic burden, get rid of some of the foods that tend to cause an inflammatory response in a lot of people, support your mitochondria and better energy production, and a bunch of other things along the way. So, and you're meant to do that sort of 21-day detox program along with sort of other things that are outlined in the book, like incorporating certain movement and motion and exercise that's non-exertional exercise, and also doing some of these mind calming, retraining the brain to get into calmer brainwave states over a 21-day period to set the stage while you're reading the book and trying to figure out what do you really have, and then helping them make the determination, where do I go next? And then there's more specific protocols and treatment pathways based on what answers you have when you read the book. Where do you think you are? And then if it looks like you really need someone to help guide you through this at a higher level, I have a lot of options for people to try to find providers that are trained in functional and integrative medicine. I give a lot of sort of advice on what kind of testing to do, what kind of things to look at to rule out if it's not actually fibromyalgia. And it was really just meant as a sort of a manual for people that think they have fibromyalgia, whether they do or not, to try to work through this and do as much as they can to be educated on it so they can find their path to recovery, because they can recover. A lot of them are, get into, and it's understandable, into sort of a chronic illness mind space where, they think it's hopeless and they think that there's no way that they can recover. And that's, in my experience, that's generally not true.
Well, it sounds like the Fibro Bible is what it sounds like.
Yeah. I wouldn't be as confident in saying that as you, but you can say it. There you go.
No, that sounds wonderful. I actually know a few people who have been battling with what they are diagnosed with as fibromyalgia, but you never know if that is or isn't.
It might be. It might not be.
And
But they have to get to the right treatment. And one of the problems with this overdiagnosis of fibromyalgia, and by the way, large studies by Fitzcharles and the preeminent rheumatologist and fibromyalgia expert using the American College of Rheumatology diagnostic criteria for fibromyalgia, has shown that physicians diagnose fibromyalgia wrong 2/3 of the time. So only about 33% of the diagnoses are then confirmed by an expert panel to be likely accurate. So that's worse than a coin toss, essentially.
That's crazy.
And the problem with that is the drugs that are approved, that are used for fibromyalgia, there's never been a drug developed from the ground up to treat fibromyalgia. They're repurposed, remarketed drugs. So 2 of the FDA-approved drugs are antidepressants. They're in the SSNRI class, selective serotonin norepinephrine reuptake inhibitors. And the other approved drug is an anti-epileptic drug, repurposed. They don't work very well. In fact, a large study by RAND showed that of fibromyalgia patients given these drugs, and that's assuming they were diagnosed correctly to begin with, less than 25% had statistically significant improvements in their functionality and their outcomes based on using those medications. And a significant percentage of those positive benefits sort of went away after about 2 or 3 months, but the side effects tend to
Yeah.
persist. And that's a problem. Those drugs have lots of side effects. They can help some people, and we use them very judiciously, occasionally with the right selected patient. But they're certainly not a panacea. They're not a cure, and they're not even a very good viable treatment in my opinion.
Yeah. No, that's scary almost in a way to know that someone's in so much pain and they're looking for a drug to help them, and there's actually probably worse side effects than
Yeah, a lot of times it doesn't
benefits.
help them, and it makes them even more tired, more groggy, more
Frustrated,
whatever,
probably.
and they lose hope.
Yeah.
And a lot of times the doctors are discounting them. They're the patient that frustrates the doctor. They pick. Humans are very perceptive. If you go in as a patient and you know that doctor is thinking, even if they're not saying it, oh no,
This patient again. Yeah.
she's here again, right? And they just inherently, they're human too. The doctors, they know they don't have anything good to offer. They don't know what to do. It's a frustrating experience for both the clinician and the patient, and it's just not a good place to be. So I do lecture all the time to doctors at conferences and symposiums on how to not have that kind of thing happen, to change the vibe. Basically, become more knowledgeable about this, be more confident about how you work these patients up, and sort of act as their lifeline
Yeah.
rather than their source of continued frustration.
Well, I mean, adding on to that, what would probably be the best advice that you could give a health practitioner if they're faced with a patient that probably has an autoimmune disorder?
Well, for an autoimmune disorder, I really think that they need to go through um, some some comprehensive workups of the patient related to their intestinal health, their gut status, their microbiota, whether or not they have leaky gut or not, what's their diet like. There's a lot to do before you just throw someone on a immune suppressor or a response modifier or a biologic if you understand what those classes of drugs are.
Mm-hmm.
Uh, um, and I would encourage them to become more familiar with the routes of evaluation of functional medicine providers in autoimmunity. I have a wonderful paper they can read on uh, my main professional site is drdavidbrady.com, just drdavidbrady.com. And in the media tab under articles, I think it is, or print, you'll see a lot of, at least a selection of some of my medical papers, and there's several on autoimmunity. There's one in the Open Journal of Rheumatology and Autoimmune Disorders. There's another in the Townsend Letter, which really sort of summarizes my approach and the things that need to be considered. If someone wants to learn more about the approach in fibromyalgia, some of those papers are there as well, but they might want to visit a different site called fibrofix.com, fibrofix.com. And you can get from one website to the other. There's buttons there. But under the media tab there's quite a bit of papers in medical journals about fibromyalgia and my approach and differential diagnosis. But there's also articles for lay folks. There's also podcasts and interviews and TV show interviews. There's a lot of resources there to learn more. But I would encourage either the healthcare provider or the person who may have it to go ahead and read the book. So you can get the book on fibrofix.com. And I also did last June a very large online summit called the Fibrofix Summit.
Mm-hmm.
And I interviewed over 35 experts in fibromyalgia and or the disorders that are often misdiagnosed as fibromyalgia. So I had global pain, fatigue, and fibromyalgia experts, but also thyroid experts and mitochondrial experts and gut experts and all the things that sort of attach to fibromyalgia either correctly or through misdiagnosis. And I also had patients talking about their experience and their navigation through the healthcare system. So that whole week-long experience and those interviews are still available.
Yeah.
If you want to access them, you can just go to fibrofixsummit.com, or you can launch it from the Fibrofix website.
Well, I was going to say, I mean, you just listed a plethora of hopefully wonderful sites that people will want to know, especially those
It'll
watching.
keep you busy for a while if you
Yeah,
want to bring them there.
I'll post all of those links underneath this video, just so people will have the tools to be able to find all of this for sure.
One thing I might recommend for practitioners, but also for anyone out there listening who has any autoimmune condition, or is suffering from skin issues, or corticosteroid withdrawal issues of the skin, is to assess the GI environment using molecular DNA kind of techniques, which are state of the art. And I helped develop a GI map test to do that. It is called the GI map, and it's from a laboratory that was developed in the incubator in the molecular biology department at Georgia Tech University, which is the #1 genetic molecular biology center in the world, actually. And it's called Diagnostic Solutions Labs. So if you go to diagnosticsolutionsLab.com, you can learn more about that test and maybe ask your provider to consider running that on you. And the lab offers clinical support and things like that to providers who may not be fully versed in interpreting the results. It does have to be ordered by a healthcare provider, though.
No, but that's amazing. I'm actually writing that down. I know I'll grab a bunch of stuff from you, but just in case.
Yeah.
And I know we're running out of time, and I'm just so thankful for all the information that you've given and provided all of us with today.
Well, thanks for spreading the word and getting this valuable information out to people all over the world, because we need to get it out every single way we can, because
Yes,
there's no giant pharmaceutical interest buying ad spots on television and doing all that kind of stuff to get the word out about these type of approaches, unfortunately.
Yeah, and I'm just grateful that there are people like you out there who aren't trying to push those other ways. You're actually trying to find the cause, the root
Well,
issue.
there's more and more of us all the time, and there's almost a tidal wave of very conventionally trained physicians who are sort of fed up with their existence, treating people the way they were trained to, and that training is very good, and it works very good for acute crisis medical scenarios, but it just doesn't work well for a lot of these chronic diseases that we're seeing in epidemic proportions in our culture, and autoimmunity leads the list. I mean, just to give you an example, the incidence level of autoimmune diseases, like let's take a classic like inflammatory bowel disease, Crohn's, ulcerative colitis, celiac, and so forth. At the turn of last century, so around 1900, in the Western world, the incidence level is estimated to be 1 in 10,000 people. Now it's 1 in 200 people.
That's insane.
And you cannot explain that through genetics alone. It's not just genetics, it's genetics, environment, diet, exposures. It's a lot of things that are ganging up on us. And I talk about a lot of that in some of those papers on autoimmunity, things like molecular mimicry, the hygiene hypothesis, and many other things that are really interesting that we really need to grapple with societally at the highest levels of public health if we're going to turn this epidemic around.
Yeah, no, for sure, certainly. It's, like you said, it's becoming an exponential problem in our day and age.
It will bankrupt us in the end if we don't turn it around. Because if you think healthcare costs are high now, just wait around 20 years.
Well, thank you for being, I wouldn't say a pioneer, but one of the main people who are fighting for this. So thank you very much.
Thanks. I try to do at least my little part, so thank you.
Yeah, well, is there anything else you would like to add before we conclude?
No, just thanks for having me on. Please check out fibrofix.com and drdavidbrady.com. And you might want to look at the summit at fibrofixsummit.com. And the laboratory I mentioned is just diagnosticsolutionsLab.com if you're interested in trying to get your health provider to do that GI test.
And grab his book.
Yeah, and buy the Fibrofix. It's right there, see? Right there, one on my shelf. I have mine, you get yours.
But thank you so much, Dr. Brady.
You're welcome.
And,
have a great day.
Yes, thank you, you too.
Okay, bye-bye.
Bye.